My name is Cecilie, and I am the founder and CEO of Wawa Fertility. Wawa is a assistant helping women and couples going through fertility treatment. We are helping them all the way from diagnostics and to live birth of a child, supporting them with everything they need when going through fertility treatment. Not only doctors, psychologists, and experts being available for them in that, but also actually a community full of people experience the exact same as they're going through.
Why did you decide to start Wawa Fertility?
Yes, that's a good question. So I've been used to working with data for many years, working as a data scientist, a data analyst, had a development agency, consultancy, working very much in FemTech, doing a lot of innovation in there. And in 2017, we got sold to KMD. KMD is the main provider of digital public healthcare systems in Denmark. So I spent 2 years working in Danish public healthcare, and I was so surprised that the level of innovation was so much lower than what I was used to seeing working in FinTech, but also very happy that there was actually something to do, something to innovate, because there's lots to do in healthcare. So my passion from healthcare comes from that. And then when trying to start my own family, a lot of my friends and family who were going through fertility treatment, that was the first time I was actually aware of this problem. Quite scary that we didn't know anything about it before. And I also myself experienced pregnancy loss, recurrent pregnancy loss. And when I went to the doctor, there was really no help to get, because you have to experience pregnancy loss 3 to 4 times before actually being able to get a diagnosis and look into what is actually happening. So that was terrible for someone being used to getting help with everything from the public healthcare system. And that was why we decided looking into this area, empowering women going through the same experience.
What do you hope to change with your solution?
Yes, that's my favorite part. I hope, first of all, to make fertility treatment better and more accessible for the millions of people in need of fertility treatment. That is our mission, and that is what is driving the entire team working on this every day. But I also hope to make it make this a way to actually build health tech companies in the future. Like, make the patient a bigger part of healthcare. Make sure that they're actually involved actively in everything that we're doing. Make them be a part of the solution. Look at each individual as an individual instead of just treating a disease or treating a condition. I think that is something that we need in healthcare as well. So we hope to also be a very good example of that.
And you also collect contextual data, right? Why do you believe it's important to collect that?
I think it's terrible that one of the biggest flaws of today's healthcare system is that we're very much only treating the body or the condition. I think it's very important to also think about the person actually getting treated. That's a very important part of healthcare. So for us, it's important to, so going through fertility treatment is not something that anyone wants to be in. But the best we can do is also to just ask them sometimes, so how are you feeling? Is there anything bugging you today? Can we help you with anything? And when getting this knowledge, we can actually be a part of increasing their quality of life while being in treatment. We can offer them something to talk to, or we're using writing therapy to actually make them process their own feelings, being better at actually putting words into how they're feeling, and that can also make them feel better while being in the process.
Did you find that women were reluctant initially to share their data?
Not at all, actually. We were discussing this initially when starting the project with a lot of the women that we spoke to face, and most of them were actually very surprised when they came into fertility treatment. It's like 70-80% of them didn't know about their own diagnosis before they actually tried to have a kid, and like waited 12 months and then got their diagnosis. So most women today are very willing to like gather all of this data if that means that we can get more answers, we can get more and better help. Like it takes 8 years today in average to diagnose a woman with endometriosis. that is definitely something we can do better. And that is the best part actually about Wawa and all of the women in our community. They're there to help each other. They're there to empower each other, not only now, but also for the many women that is going to be in this situation the next years.
In what ways are you optimistic about the potential for data to improve the fertility journey, and why do you think data hasn't been leveraged before?
Yes, very good question. So I'm optimistic because we've been doing some initial tests on the data that we're gathering. We can see that we're able to actually predict better treatments and better outcomes. And for us, again, better treatments is not only it going very fast, it's also can we actually help women go through fertility treatment maybe with less medication dosages, or focus on who would need mental health support on the side and stuff like this. So the biggest problem today, and why I'm also optimistic, is that this data has just not been available. So this is a very special part of the healthcare sector, also in Europe, where a lot of the treatments are going on in the private sector, or in different like gynecologist clinics, and some in public treatment. And that actually means that all of the data is very scattered. It's not very structured data, and the clinics are using it very differently. And because of this, it's hard for researchers to actually get this data available and do more and better research into the area. So just us gathering this very big database of real world data from fertility treatments will be able to actually accelerate research, but also to optimize the treatment going on today. Because today doctors are deciding, and they're really good at it, but they're deciding based on their own experience what is the right way to treat people. And we know from many other parts of this world, but also from healthcare, cancers like way in front of fertility in this field, that you can actually use data to learn from it historically and then predict better ways of treating people. So that makes me very optimistic.
And what would you say the status quo is right now for women undergoing fertility treatment?
Very bad. So more and more women are going infertility treatment. Not only because of female diagnostics and female lifestyles, and that women are getting kids later in life. So looking at the male perspective, actually male sperm quality has been decreasing with 50% over the last 40 years. Was just done a new study saying like in 2015, almost every male will need help to actually be able to have a kid. That is where we're going if it's the same development as we've been seeing the last 40 years in male sperm quality. And fertility treatment or infertility, decreased sperm quality, is actually the only chronic disease globally that you're not treating the patient for, you're treating another person, the woman. So right now, the status quo is bad. It's decreasing. This area is not getting enough attention. Success rates in fertility treatment are approximately between 2 to 20% per cycle. I don't know any area we're accepting that low success rates in treatment, especially this is an area where it's very important. This is how we're going to evolve as a society in the future also. We need new children, we need families, and for me especially, this has been the most important area of my own life, being able to establish a family. I think this area needs much more focus than it's getting right now.